As far as Medicare is concerned, this time I'm going to be the conservative and the deficit hawk and not the president, because Medicare is going to be a disaster 40, 50 years from now if we don't do something about our healthcare system that's more comprehensive than what we had under last year's health reform. The public option would have helped, but we now know that was dealt away in negotiations that weren't publicized at the time. So, look, this is not a good situation, but I don't demonize the president. I think he's in a kind of bubble where a lot of people think like this, including people that are nominally or very much on the left. I don't make a habit of picking on other people that are part of, fighting the good fight, but we're going to run a clip now just that kind of demonstrates how easy it is to slip into wrong thinking about how to handle these situations. And it's some commentary from a good guy, a very good guy who does a lot of great work and great commentary, Lawrence O'Donnell, who was part of the whole Washington Democratic scene in the 90s. And really what we're seeing now is a carryover and a misapplication of the lessons from the 90s, even among some really smart and well-intentioned people like Lawrence O'Donnell. And so I think it's worth listening to what he has to say. And as a friend and now, I don't know him personally, but then as someone who thinks we're on the same side of the issue, pointing out why Lawrence O'Donnell is completely wrong. So let's go to clip 11, and then we'll talk about it a little.
And it is worth noting at this time that in this bill are a couple of $100 billion in Medicare and Medicaid cuts that were proposed and supported by President Bill Clinton, written into law by a Democratic Congress and passed with Democrat votes only. The biggest cuts ever enacted in Medicare at that time. That was the very first thing that Democratic President Bill Clinton did with Medicare. Actually cut it to no objections, none. Not one word of objection from liberals at that time about cutting Medicare. Not one person who has attacked President Obama from the left for even discussing Medicare cuts objected to the Clinton Medicare cuts, which were supported by every liberal in the United States House of Representatives and the United States Senate.
You're not in the habit of picking on people who generally are fighting the good fight, but boy, is he learning the wrong lessons here from the 1990s. And he's talking about a bill that he says he wrote himself. He has a very distinguished career on the Hill before he went into television. He worked for Senator Moynihan, who pioneered a lot of the kind of third-way Democratic politics of today. So he's referring to a bill that he wrote, as he puts it, and I'm sure he did. He doesn't say which one it was or what year it was, but I think in looking it up, I think he was referring to the Omnibus Budget Reconciliation Act of 1993. So I think there are a couple things he's leaving out of the narrative, especially if it's that bill. That bill, which cut Medicare, was passed in 1993. The Democrats lost Congress in 1994. So first of all, there may be an instructive political lesson here that if you cut wildly popular programs, you lose political seats and political power. So it may be that those people he's railing against for their hypocrisy in Congress learned a lesson that other people in the Democratic Party haven't learned, and maybe that experience was enough to let them know they don't want to make the same mistake again. That's number one. Number two, medical costs have soared since 1993 at a rate of sometimes easily twice and sometimes 3 times overall inflation. So to start making cuts in benefits and copays and deductibles and so on now, nearly 20 years later, 18 years later, would be devastating for a lot of people, including a lot of people who might very well hit this sort of means test ceiling that the president is talking about. So that's a big, big, big mistake. And again, number 3 is that why do we put our cards on the table on the progressive side when the other guy isn't putting his cards on the table? You know, Lawrence O'Donnell, again, I said great guy, but he's off on this whole deficit issue. He did a thing for Esquire where he had his own quote-unquote deficit commission. Right away, When you say, yes, Esquire, I will do a project for you where we find our deficit cutting project, and I'll get some Republicans and Democrats together, and by the way, some funding from the right-wing Pete Peterson Institute to do it, then you've lost the game. Because a political scientist said many years ago, the trick is not telling people what to think, it's telling people what to think about. We've been told that what we need to think about right now is the deficit. We need to think about the deficit 2 years from now. We need to think about unemployment now. We need to think about getting the economy moving now. We need to think about consumer confidence now. So this is all buying into the old game, the old frame, and I'm really afraid that what we've seen just in that little clip from Lawrence O'Donnell, great guy, I keep saying that, is exactly what's throwing the Democratic Party off a cliff right now.
She was walking with a limp.
Yeah.
Do I look cooler when I do that? No, not buying it. Put down your sandwich. I need to judge who ate the most. I won, right? Did Anna win?